Welcome to the Deep Dive. Today we're talking about something vital, but often silent: your liver.
That's right.
We're looking at why getting tested locally, like in Camberley over in the UK, is so important. And we're using a guide from Blood Test UK to explore this.
Yeah, the liver's like the body's processing plant, right? Detox, metabolism, all that. But it doesn't always shout when there's a problem.
Exactly. It whispers, or maybe doesn't even do that. So these tests, they act as an early warning.
That's the idea. This guide from Blood Test UK really highlights how simple blood tests done locally can be a crucial checkup.
So what are we trying to figure out today?
Basically, why getting this check done near you, close to home, makes such a difference. Blood Test UK makes a strong case for it.
Okay, let's get into it then. What do these liver tests actually measure in your blood?
While they look for specific things, mainly enzymes, you'll hear names like ALT and AST, and also bilirubin.
Enzymes. ALT, AST, what do they tell us?
Think of them as being normally inside liver cells. If your liver cells get damaged or inflamed, these enzymes sort of leak out into your blood. So high levels in the blood, that's a signal. It tells doctors, hey, something might be stressing the liver here.
Ah, okay. Like a warning light flashing on the dashboard.
Precisely. An early warning, hopefully.
So here's the bit that seems really key, especially from the Blood Test UK perspective. Why is regular testing so essential? If you feel fine, why bother?
Because, and this is crucial, many serious liver problems, things like fatty liver disease, even early cirrhosis, they often have no symptoms at first. None at all.
Silent problems.
Completely silent. So regular testing, like Blood Test UK advocates for, allows for early identification. You catch it before it becomes a major issue. And the earlier you know, the better your chances are for treatment to actually work well. It's fundamental for managing liver health effectively.
Right, that makes sense. Don't wait for the alarm bells, check the system regularly.
Exactly. Proactive, not reactive.
Now, let's talk about the local aspect. For people living in Camberley, for instance, what's the real advantage of using services right there?
Well, the Blood Test UK guide points out that local places like Camberley Health Centre or Frimley Park Hospital aren't just convenient. They often have the latest diagnostic tools, yes, but crucially, they know the local community and patient care is right there.
So it's faster, easier.
Both. Easier access, shorter waits perhaps, and potentially smoother communication between the testing center and your own GP. It makes the whole process less of a hassle. This local focus, it genuinely helps improve health outcomes for the residents.
Okay, practical benefits. Can you give us a concrete example? Did Blood Test UK mention a specific case?
Yes, they did. There's a really good example in the guide. Someone was feeling generally tired, that unexplained fatigue lots of people ignore.
Vague symptoms.
Very vague. But they went for a local test. It picked up elevated liver enzymes, leading to an early diagnosis of non-alcoholic fatty liver disease, or NAFLD.
And because they caught it early.
Because they caught it early, they could make specific lifestyle changes. Diet, exercise. And the guide says their liver health markers improve significantly.
How quickly?
Within just a few months. It shows that catching it early through accessible local testing lets people take control and see real results fast.
That's a powerful story. It connects the dots between easy local testing and actual health improvements.
Absolutely. It highlights how regular local checks help you actively monitor your own health and make informed choices based on what your body is doing.
So wrapping this up, what's the big picture here?
The big picture, really emphasized by Blood Test UK, is that early local testing isn't just about finding disease, it's about empowerment. It gives you, the individual, the power to be proactive, to catch potential issues when they're small and manageable before they turn into something serious.
It's about preventing the big problems down the line by paying attention now, locally.
Couldn't have said it better myself.
Okay, here's something to think about then. We see how local, regular testing can potentially stop a silent disease like fatty liver disease in its tracks. So what other silent conditions might benefit from this kind of proactive, localized approach in your community? What else should we perhaps be monitoring routinely right where we live to secure better long-term health?